And now a Republican view of all this. It comes from the person I just quoted, Senator Orrin Hatch of Utah. He sits on the Finance Committee as well as on the Health, Education, Labor, and Pension Committee. Senator, thank you for being with us.
Well, nice to be with you, Judy.
Senator, you may have heard Secretary Sebelius just now say this is simply an attempt to let states come up with their own structure, their own way of providing coverage, as long as they cover the same number of people and they don't increase the costs.
As long as they continue to do all that Obamacare requires them to do. I mean, she just didn't know what she's talking about, because this waiver does not do one thing for anybody. And the fact of the matter is, if you read the law, you realize that it's not going to help the states at all. The states now are $175 billion in the hole. That was before this doggone bill. Now there's another $120 billion going to be added onto them. And you'll notice she said that as long as they meet all the qualifications of the law, which they can't do. They've moved 16 million people under the state Medicaid rules. And at the time, the government did put up a little bit of money, but now that money's gone and there's no way the government can help them. And the states are in an uproar because they really can't do this. And, you know, I have to tell you, they have mandated the states to have to live with provisions that really don't make sense. And this waiver business, moving it up from 2017 to 2014, doesn't do a thing. Well, the waivers aren't going to help.
Again, Senator, I mean, what I heard, and I made some notes on what she said if a state has a strategy different, for example, from the individual mandate wherein they could automatically enroll people, she said, in various plans or work it out some other way, and she said this is an attempt to let the states write their own plan.
Oh, isn't that wonderful? If the state has another way of doing exactly what they want done, then the state can do that. Well, my gosh, I think everybody knows that. The problem is the states can't afford to do what they are demanding here. And yeah, they're saying if they want to move away from the individual mandate, how do they do that? The individual mandate, which I think is unconstitutional. 28 states now think it's unconstitutional. 2 major federal judges think it's unconstitutional. For the first time in history, they're going to apply the Commerce Clause to an inactivity. It's always been applied to activities in commerce. And if they apply it to an inactivity, in other words, the desire of state governments and people in the states not to purchase this insurance or not to purchase this health care, it'll be the first time in history they've done that. And if they can do that, they can do anything to you.
At one point, Senator, we heard the Secretary say, she said that you and she have or you and the administration have a different fundamental view on who ought to be covered, that you don't agree that more Americans should be covered. Is that accurate?
That's what I call bullcorn. I'd love to cover everybody. I'd love to make sure nobody suffers from a lack of health care. I'd love to be able to help everybody. But there are some economic realities that we're going to have to realize, and the states are here up in arms. And these aren't just Republican governors up in arms. These are Democrat governors that know that they can't meet these mandates, that this idiotic bill is requiring them to meet. Look, I hate to be mean to anybody. I hate to talk this way, but it's true. It is one of the worst pieces of legislation in the history of this country. And it's not going to work. And they know it's not going to work, so they phony it up with these, well, we'll move these waivers that aren't going to work. We'll move those from 2017 to 2014, but you got to meet all the requirements of the Obamacare law as it is. Well, now, what do you think that means? It means the waivers aren't worth the paper they're written on.
So, Senator, you don't see any middle ground at all on this health care reform?
Yeah, I see a middle ground. They ought to trash the bill and get rid of it and sit down with Republicans and Democrats who really care for this country, who really want to put together health care so it will work for everybody. And let's see if we can do a bipartisan bill instead of this totally partisan bill that will work in this country. And you knew that's what was going to happen when they refused to work with Republicans. All 60 Democrats in the Senate had to pass it, not one Republican. All of the Democrats in the House had to pass it, not one Republican. And there's good reasons why the Republicans didn't support this bill. And now they find themselves in trouble. So what do they try and do? They phony it up by saying, well, we're going to move this waiver situation from 217 to 214, but you have to meet all the requirements anyway in the bill. I mean, my gosh, anybody with brains will know that ain't going to work.
And what I did see, Senator, there have been comments from administration officials who were briefing reporters after the president spoke who said you know, that this allows states the flexibility to move in a different direction. For example, if it's a state that wants to move more toward a single payer system, that's one thing. Or if it wants to move, they even use the example of your state, of Utah, said if they want to move in the direction of what Utah does, we want to give them the flexibility to do that.
Well, we Republicans would have made sure that there were 50 state laboratories to begin with, so that you could pick and choose out of the various states what really works. Utah happens to have a fairly decent health care system, and they are heralded by the rest of the states and by the rest of the country. But we're having our troubles out there as well. And I have to tell you, the way they're going, doctors are not going to be taking Medicaid patients. We already have 40% of the doctors saying that they may retire rather than put up with this type of stuff. And then talk to the governors, talk to the Democrat governors.
Well,
ask them how they like these waivers. Ask them how they like Obamacare, and you're going to find that they're beside themselves.
As a matter of fact, we did look for some quotes, some comments today, I should say, from governors. Some of the Democratic governors said they're interested in this. They think it opens the door. And I'm going to quote, your former Republican colleague in the Senate, Sam Brownback. He's now the governor of Kansas. He said, yes, he does still object to the law overall, but he sees what the president said today as a positive thing. He said, well, this does offer some flexibility.
Well, when the president talks positively, that's great. The problem is he's saying you still have to meet all the requisites of this law, and the states can't afford to do it. We're talking about a maintenance of effort problem here that the governors, both Democrat and Republicans, are up in arms over. Look, I'd love to see a system that would work. I think we could have had one that would work. This one is not working. Don't think that those waivers mean anything. They really don't. You read the Associated Press article today. They basically said these waivers aren't going to work. And frankly, they're not. And the reason they're not going to work is because they've piled all this stuff on top of the states, run by nothing else but the almighty federal government. And I know what's going to happen if President Obama is reelected. Within a couple years, he's going to throw his hands in the air and say, this isn't working. We must go to a single-payer system. In other words, a Washington determination, completely done by Washington, and in other words, socialized medicine.
We did just hear Secretary Sebelius say this was not and is never intended to be a federal government takeover. Finally,
come on. You can't look at it without knowing that the federal government is totally dominant in this bill. That's why people are up in arms.
Very quickly on Medicaid, serving the most vulnerable Americans, the idea that states could throw some of those people off coverage altogether, the administration trying to stop that. What's your response to that?
Well, what do the states do if they've got $175 billion in the hole right now, and then they're going to have to come up with another $120 billion? This is the worst situation since the Depression. And nobody wants to hurt anybody. People got health care before. They had to go to emergency rooms, but they got it. I'm not saying that's what we should return to, but we could have come up with a bill that would have much more economic sense, would work better, would have both Republicans and Democrats together. No, it was an arrogance of power that they had, that they just put this through this way. Now look, I don't like finding fault with my Democrat friends. I don't like finding fault with the president, and I don't even like finding fault with Secretary Sebelius. But to be honest with you, what she said is, if you read through the lines and you read what she said, you're still going to have to meet all the onerous provisions of this bill, and you can't do it. That's the problem.
Coming through loud and clear, Senator Orrin Hatch. Thank you very much.